So this was all about what doctors should keep from the instruments perspective and also from the drugs perspective. There is a textbook recommendation which we should know about if we are practicing full time uh, uh, home visits and home care. But uh, mostly you can select and decide on what your type of patients or your community requires, and accordingly, as I discussed, certain things I would prefer to keep and others I would not. Now, emergency telephonic consultation. Nowadays, all consultations for patients are emergencies. So even if they have minor ailment, they will think it is emergency. But when there is an actual emergency, most of them would know and they will rush to hospital. So we have to believe and trust the insight and instincts of the patients. There may be confusion sometimes, but as professional, it is our role to guide them to a proper channel. But in my practice, the kind of patients I used to see, I can say that 90% of the patients can be, you know, handled on teleconsultation by itself. Even if it is not a pain situation or pain abdomen like situation, most of the cough, cold, fever type of things, diabetes, thyroid, and all can be handled on teleconsultation or video consultation nowadays. And as I said, it is important to train your own staff to handle calls. So I have a 24-hour appointment booking line which is handled by my secretary, my staff, and she is the one who will give uh, appointment for my video consultation or consultation and other things. So it is important that we learn to use telephone in a right perspective. Many times we do not want to talk to patients, we do not want to give our numbers to patient, but this is not helpful in practice overall. Even if you are not available, suppose the ATM is closed and bank is also closed, there's no banking. Similarly, if your telephone number or company does not give you a helpline number, then you know you feel distraught. So similarly, our service is also a service. So you know we have to have a virtual telephonic reception, virtual telephonic interface, where patient can call us, and if they are facing any problem related to appointment consultation, uh, wanting to understand the dose, if there is something confusing in the prescription, it should be immediately resolved. And that support we should provide to our patients rather than keeping ourselves aloof and not wanting to share our personal details or time with the patients. So it is our service. The better you do it, the better you get patients. And it is having a good communication and continued relationship with your patients and community is most important part of running a long term practice. I never hesitate to give my number to my patients. They can call me. It irritates at times, but most of the times I use it professionally. I tell them, I'll talk briefly, I'll direct them to the concerned person, my secretary or my clinic. If it is urgent, I'll be helpful. But that is my work. So, and I also use a IVR service, interactive voice recording service, so that all my telephonic conversation related to clinic and my consultations are recorded, and I can listen to them. I can check when they were called and information who called, what time it was called, and all these recordings are preserved. So there are several IVR companies which you can use, not very expensive services, but this helps tremendously, and you also keep record. So if in last 3 months, if 10,000 people have made call to my reception, I have number of all of them. So I can send them a good morning or New Year wishes or holy wishes, even in once in a year, they will all remember me. So it is important to keep relationship and data of patients, their phone numbers, their addresses, if possible, email IDs, and you can communicate with them, not necessarily on medical subjects, but also sometimes general greetings like Happy New Year, and that will give a good rapport, reputation, and relationship with your patient and community. So it is important to collect data of the patients also while you are providing them service on telephonic interface. So these are the common advices given simple language, talk brief. Many times patients want to talk elaborate, so you can ask them to briefly talk about their problems and what solution they are looking for. And in majority of the cases like trauma, GI bleed, MI, stroke, burn, unconsciousness, it is always important to tell them that this is an emergency and it cannot be handled on phone. Better to visit hospital directly. So if I get a call for patient not responding, I tell them go to hospital, ask them if is patient responding, is patient talking. Then I will decide on the basis of that whether to make a visit or not. And many times patients may call unreasonably. So nowadays someone calls me, are you available at your clinic, are you simple things, can I eat this thing and that at that thing. So I tell them nowadays that for smaller things, for appointment you call this number, and for if you're very urgent you can give me a call, but most of the time you should message me on WhatsApp and I'll read them, and if it is appropriate I'll give a reply also. So I try to manage this overflow or flow of communication. It is very very important to keep uh, addressing your patient's concerns. If as yesterday I treated someone for uh, upper respiratory tract infection, but when I today I got a report that the person is suffering from gastroenteritis. Now these are two different things: upper respiratory tract infection and gastroenteritis. And if patient is not able to reach out to me, patient will not be suffering, patient will not be satisfied and never come back to you. But if you are available, if you are accessible and you provide solutions, so I today I immediately change my prescription and I hope the person will be fine. So if patient is has to say something, we should develop a mechanism where they can reach out to us. So, emergency visits, I've already discussed. If it is so emergency visits, we must be very judicious, and it comes with experience. But mostly, as I said, major illnesses we should try to avoid. But sometimes, patient still, uh, normally I would not want to visit when person has already died. But because of social reasons and also the community that we serve, many times people want us to visit a home to confirm deaths. This is a tricky situation. I do visit sometimes. I do often actually, if the person is known to me, if it is in neighborhood, and I'll examine and declare death. Mostly, I avoid giving any written, declaration or anything like that, unless it is very, very, mandatory or unharmful for me. And at times I advise them and counsel them to get a death certificate. It is not doctor's role, it is the role of the local municipal department to give you a death certificate. And for that you need the receipt from the cremation department, sorry, cremation ground or cremation place. And cremation place would mostly rely on your medical records, and if five people at many places, if they agree that this is a natural death, then cremation people will not have any problems. And that cremation, sorry, and cremation, receipt is good enough to make a doctor's declaration is not necessary, because if you are not a treating doctor, it is not wise to give a death declaration or giving a natural death certificate. Many times patient will ask that they want to travel from one place to another place, and for ambulance they will require a medical certificate and all. But if you are sure, if you have patient's medical record in access, if you know that this was a patient who was receiving treatment for this in this hospital and they have consulted you before, it it may not be harmful to give a body carrying certificate. It is a end stage disease or a very elderly bedridden for a long time, you all know already. But if you do not know history, sudden death of any age of person, it is not wise to give anything in writing. If they insist on writing, you say that it is not your role to give writing. And another thing, I never charge. Whenever I'm call for and I find patient dead, I never charge. Never ever charge for a dead person, because it will land you in problem, and it is not morally and socially correct to ask for money when somebody already died. You know, it is out of social courtesy. So emergencies, these are important consideration for our practicing day to day experience, but never also be hesitant and very reluctant or very rude about not visiting a dying person or dead person. There's no harm. Somebody has died, you go and you declare. Many times people wants to hear from a doctor's mouth. Already they are knowing that person has died already, but declaring verbally by a doctor also is a kind of a gesture where it confirms that okay, actually person has died. For those situations you simply require some most of the times torchlight is good enough to examine the pupils. And if the person is not young and all, you can ask for medical records and all, try with an interview. And if you find something suspicious and doubtful, don't hesitate to inform police. They will Law will take its own course. So this is how I practice. So being prepared, most important, as I said, your mobile should be charged, your car should have fuel, petrol or diesel. You should have GPS if you are looking for a location. Nowadays it's easier to share location WhatsApp. Check your bag that your BP instrument is functioning. It has, if it is electronic, it has battery. Your thermometer is not broken, and your stethoscope is functional one, not an ornamental one. Many times we keep on ignoring these minor things, but at times in emergencies you will find that the strip of the glucometer has run out. You will have glucometer, but you will not be able to test sugar. So all these requires regular maintenance. So at least once in a month, check your bag. Keep your home visit bag separate from your routine clinic practice so that you are able to maintain it in a way, and always keep it in your transportation car except for the medicines which may require a better situation to handle, or away from warmth and sun and cold. So these are the common things for being prepared. It starts from your vehicle, your mobile, and coming to your doctor's bag. uh, just for this, if you see me, I've started wearing a uniform even for my clinic. Most of the doctors don't wear any scrub for clinics. This is taken as surgeons domain. When you visit a operation theater, you wear a scrub to prevent infection. But all the time, 24 hours, even if you are at small clinics nowadays in COVID situation, it is important that you wear your scrub, gown or uniform for clinic. Initially I thought, even my wife joked, you look funny in your dress, but I see that there is a lot of respect and good understanding from the patients in the community when they see me in a scrub in my clinic also. So it is comfortable also, if you are working 10, 12 hours, 14 hours in your clinic or whichever situation, it makes you comfortable and you are not worried about your presentation, your dress. uh, so I advise you all to use some scrub, some kind of uniform at a clinic also. It may look a bit awkward at times in the beginning if you wear so, because most of the outpatient OPDs, family physicians don't wear any uniform. When I visited Prague, European countries, China, everywhere doctors and pharmacists wear uniform. Not a single doctor you will see without white coat or a scrub, even in small clinics. So this is our culture that we want to look whatever way we are, but it is important to change as family physicians that we wear our own. Like the dress I'm wearing costing only 800 rupees per set, and for 2,500 rupees I can spend 6 months without spending money on other type of clothes for me in summers. So this is also important, hygienic, and also prevents you and your family from infections. It is very comfortable, also cost effective. You can also buy from market, and you can also use it for home visit. Because people, if you are uniform, a uniform person is identified by the uniform itself. So You will not need to introduce yourself many times. At security guards, people in the lifts or in the community may ask you, who are you? But if you're wearing a uniform, you're having a stethoscope, they will outright recognize you and they will let you in and they will respect you and they will let you do your work. Otherwise, there will be hindrances in home visits.